All right. Good morning, everyone. Let's do a quick testing before we begin here. Can you hear me through the webinar? Testing, testing, 1, 2, 3. Testing, testing, 1, 2, 3. All right, perfect. We are all set. Good morning, everyone. Welcome to our eLotus webinar today. My name is Donna, and I will be your host and your moderator for today's class. Here at Lotus Institute of Integrative Medicine, we have been holding educational seminars and webinars for over 2 decades now, and it's been such a great journey filled with many experiences and lessons taught by speakers who are not only experts in their respected fields, but more importantly, they're willing to share their wealth of knowledge with all of us. We believe that the future of TCM and the advancement of Chinese medicine can only be obtained through continued growth, learning, and progress, and that's our goal here, which is why we are so happy to have you join us today. Today's class is an introduction to Chinese herbal medicine, focusing on downward draining and digestive herbs with Dr. John Chen. And Dr. John Chen is an herbal consultant over at Evergreen Herbs, and he holds a degree in pharmacology as well as in TCM in Chinese medicine. So let's go ahead and give him a big warm welcome.
All right, thank you, Donna. Okay, let's do a quick audio and video check to make sure everybody can hear me. So if you can, please type in the chat room that you can see me and hear me fine, so our tech can let me know if it's good to start. All right, looks good. All right, once again, it's a pleasure to be here. Today, we're going to focus on 2 chapters of the Chinese herbs. One is downward draining herb, and the other one is digestive herbs. And I think both of these chapters are very important because, quite literally, anatomically, we are what we eat. So whatever food that we put in our body, we need to be able to digest it, absorb it, and have it become a normal functioning part of our body, anatomically and physiologically. If for some reason we are not able to digest it, absorb it, or if we have obstruction, where we end up absorbing what we're not supposed to, then that can lead to a lot of disease and problems later on down the road. And that's why I think these 2 chapters are quite important and ones that we need to know well in order to help and treat the patients. All right, so we'll start first with downward draining herbs and also formulas. All right, this category describes the action of substances, and that includes herbs, minerals that treat interior excess syndrome via purgative, laxative, or cathartic means. All right, so this is the Chinese description and definition of the herbs in this category. Mainly, downward draining herb treat interior excess syndrome. And then in turn, interior excess syndrome is describing first, interior is the opposite of the exterior. All right, so this is not an exterior condition, but interior condition. And then excess is the opposite of deficiency. All right, so this is a condition where there's too much of. All right, so basically this is referring to the inside of the body that has an exuberance of heat, cold, dryness, or fluid. And basically as the accumulation of heat or cold or excess amount of dryness or fluid builds up, then it begins to affect the normal health and physiology of the body. Generally speaking, the signs and symptoms or the manifestation of these conditions include constipation, food stagnation, intestinal obstruction, and also water accumulation. All right, and between these 4, constipation is by far the most common. And the reason, of course, is because if our digestive system is not functioning properly, generally speaking, constipation will be the first symptom that shows up. Okay, and food stagnation is also possible. This happens quite a bit in people who have poor intestinal peristalsis or poor digestive function. And then what happens is, if they are just slightly uncareful with what they eat, okay, and by that I mean eating too much, eating what they are not supposed to, maybe deep fried greasy food or processed food or canned food, things that are hard to digest. Then what happens is the food, they can tell you, feels like it's sitting in their stomach or their intestine for a long period of time. Maybe not to a point of constipation, but it just feels like it sits there. All right. And then, of course, a much more significant problem would be intestinal obstruction. Okay, and that is when things, literally food or feces, is actually sitting there not moving. And then in turn, what happens is as the intestines continue to squeeze and move, it's starting to tie a knot. Okay, so intestinal obstruction is actually a serious and urgent condition, okay, that can be treated with herbs in this category. Even though this is a condition we probably don't see a lot of. Okay, most of the patients with intestinal obstruction have a very severe excruciating pain, and by and large, they'll call 911 and check themselves into urgent care or emergency room. Okay, and then the last part of interior excess syndrome is water accumulation. Okay, and this is beyond the common edema. Okay, usually water accumulation in this case refers to ascites, which is common in liver cirrhosis, or pulmonary water accumulation. Okay, so much more serious than just the pitting edema. All right, so overall, the downward draining herbs are primarily used to treat interior excess syndrome, constipation being the most common, but they certainly can be many other manifestations. All right, and then these are some of the disease names from a Western medicine perspective. So what we in TCM generally call heat in the stomach and small intestine, generally the Western medical diagnosis can include constipation, simple acute intestinal obstruction, adhesive intestinal obstruction, roundworm or intestinal worm intestinal obstruction, cholecystitis, pancreatitis, and also appendicitis. All right. So all these itis type of disease, whether it's hepatitis, cholecystitis, pancreatitis, appendicitis, and so on, when you think of itis, think of it as a combination of both inflammation and in some cases infection. All right. So basically, this is an excess of heat or excess of damp heat in the interior. Right. So that fits the definition of interior excess syndrome. Okay. So these are the acute interior excess conditions that can be treated with downward draining herbs. All right, so once again, don't think of downward draining herbs simply as herbs for treating constipation. They do have much broader clinical applications. Okay, and as far as fluid retention, this is the water accumulation that we talked about. Once again, it's not just a simple pitting edema, but this can be from pleurisy, peritonitis, ascites, and also heart failure and so on. Okay, so much more serious consequences of fluid retention and water accumulation. Okay, as far as TCM is concerned, downward draining herbs are generally broken down into three subcategories. There is a stimulant laxatives or purgatives. There is a moist laxatives, and also the harsh expellents or cathartics. Okay, and what they are broadly is that the stimulant laxatives and purgatives are the ones that have a strong effect to stimulate the digestive system, namely the intestines. So what happens is they stimulate the intestines to increase the peristalsis by the intestines, so the intestines can continue to squeeze and push the intestinal content down the line in a rhythmic pattern. Okay, and this is how the food goes from the stomach to the small intestine to the large intestine and eventually out of the body through bowel movement. Okay, and then what happens is a lot of people have a slowed peristalsis or lack of intestinal motility. Okay, and this happens, well, there could be many reasons why this happens. One of the most common is drug induced. Okay, it could be mainly from the antipsychotics. Okay, antipsychotics are generally used for treating patients that have mental disorders, whether it's mania, schizophrenia, bipolar, and so on. And what happens is these antipsychotic drugs, in addition to suppressing the central nervous system, they also have a suppressing effect on the digestive system. And they slow down the intestinal peristalsis quite a bit, to a point where patients usually end up with severe constipation. All right, so drug-induced lack of intestinal peristalsis is one of the main reasons. Another reason why a lot of people have lack of peristalsis is from the stress. Okay, so what happened today is we all have certain amount of stress in our everyday lives. Okay, whether it's from work, from family, from school, whatever it may be. And what happened is most of these stress are, generally speaking, somewhat low to mid level, but on a consistent basis. And the reason I say that is if you compare evolutionary speaking, okay, where if you think of a caveman, right? What happened is the caveman may be under intense pressure at times and no pressure at other times. Okay, so imagine if the caveman was being chased by a predator, whether it's a lion or tiger or whatever animal. Then what happened is the caveman needs to be run away very quickly or get to a safe place. So during that process is very intense pressure. Okay, so the body's adrenergic system kicks in, and the caveman has to be able to run away. But once the caveman is able to escape, then the pressure goes away, and then they can rest and recover. Okay, but today, what happened is we don't really have a predator chasing after us, but instead our pressure, may be from whatever it is. It could be from your house payment, your mortgage payment, your job, right, and so on. And what happened is if you buy a house, how long is the mortgage payment? Right? It's usually about 15 years or 30 years, right? So what happened is the pressure is obviously not as intense as a predator chasing after you, trying to kill you. So, but it's much longer and it doesn't seem to go away easily. So what happened is with all these sustained pressure in Chinese medicine, then what we have is we have the liver qi stagnation representing the stress, and that then overact on the digestive system. And then digestive system becomes weaker and weaker. Okay, and over time, then what happens is the spleen becomes weaker, the stomach becomes weaker. It's not able to digest the food. It's also not able to push the food content down. All right, so what you see then is gastroparesis or lack of intestinal motility. All right, so again, this is another major reason why there's indigestion, food stagnation, and constipation. All right, so for all those things that we mentioned just now, then what happened is you need to use some stimulant purgatives or stimulant laxatives to quickly get the intestine moving again. Okay, and this is once again to treat the symptom. And once you are able to get the bowel movement going, once you treat the food stagnation or constipation, then after that, you then have to use the GI tonics, herbs to strengthen the spleen and stomach to treat the underlying problem, as well as herbs to treat the liver qi stagnation. All right. So anyways, the first category here is the stimulant laxatives. And once again, these are herbs that are generally speaking quite strong and have a very quick onset of action. All right. And in comparison, the second category is called moist laxatives. All right. So these herbs are generally mild to moderate in potency, and they don't really stimulate or irritate the intestines that the first subcategory does, but rather the moist laxatives are mostly the seeds type of herbs, and the seeds have a lot of lipids. So what they do is they moisten the intestines to help to facilitate the food moving along the intestines and eventually get passed out. Okay, and these herbs are most beneficial for patients that are weak or deficiency or have some type of underlying illness. Okay, and what happened is these patients that have some weakness and deficiency really should not be treated with very strong purgatives, and that's why moist laxative in this case becomes very beneficial. All right, and the last part here are the harsh expellents or cathartics, and these are the herbs that are generally used to treat a more severe condition, such as ascites, peritonitis, maybe appendicitis, and so on. Okay, so once again, this is the area that I mentioned earlier, that these are indications for downward draining herbs and formulas. But in the United States today, or in most of the developed country today, these are considered to be urgent or emergency conditions in which patient usually will go seek treatment in Western medicine. All right, so now let's go ahead and look at some examples of single herbs and herbal formulas. Okay, the first one and probably the one most commonly used is an herb called Da Huang, Radix, and Rhizoma Rhei or rhubarb. Okay, Da means great and Huang means yellow. Okay, so in a way, the pinyin name is trying to tell you what it is. Da, is big. It tells you that this is a very strong and potent herb. And Huang is yellow. Yellow means heat in Chinese medicine or in Chinese culture. So this is a great herb, great potency herb to treat all kinds of heat conditions. And this is, in this case, heat is from infection, is from inflammation, is from accumulation of excess condition in the interiors. So from a Chinese description, Da Huang rhubarb is a great herb to attack the accumulations and purge them downwards. This herb purges and clears fire, clears heat and eliminates toxins, and also activate blood circulation and removes blood stasis. All right. So overall, the first three functions are the most commonly used. Okay. So once again, purge downwards, clears fire, eliminate toxins. All right. From a pharmacological perspective, the most commonly used is the laxative or purgative effect. So once again, Da Huang or rhubarb is a very strong stimulant that stimulates the intestines to induce peristalsis and induce bowel movement. All right, so when you take this herb, it actually works in three separate ways, 3 separate times. And what I mean by that is, as you take the herb, what happens is obviously you take it in your mouth, you swallow it, it goes to your stomach, and then it goes to the intestines. All right, so at that point, what happens is some of the herb will start to work directly in the intestines. Okay, but at the same time, it's also absorbed. So it's absorbed from your intestines to your liver, and then to your blood, and then through the blood it goes back to the intestines. All right, so what happens is when the herb is absorbed, it goes to the liver. The liver will also secrete the bile acid that will then go back to the intestines. Okay, so that's the second time that the Da Huang will go back to the intestines and increase the intestinal peristalsis. And then after it's absorbed into the blood, it then goes back to the intestines, and that's the third time that it's going to work and stimulate the intestinal peristalsis. All right. So generally speaking, Da Huang, the onset of action is somewhere between 6 to 8 hours. All right. So when you take this herb, you're not going to get a bowel movement right away, but it does come around after 6 to 8 hours, and the effect is very, very strong. All right. So this is an herb that's generally reserved for the more urgent situations. So if you're using it for treating interior excess conditions or treating constipation in general, I would say the patient needs to be otherwise healthy and robust. Okay, preferably have an interior excess condition or a constipation condition that had persisted for a few days. Okay, that way the severity of the disease warrants the potency of the herb. Okay, so that's how Da Huang works as a laxative or purgative, mainly through the stimulation of the intestines to increase peristalsis. Okay, Da Huang also has an excellent anti-inflammatory effect. All right, so what happens is if you have any disease, or no, I wouldn't say any, most of the disease of the internal organs that has a itis in it, okay, then what happens is internal organs with inflammation is obviously an interior excess condition. So Da Huang is a great anti-inflammatory herb for treating inflammation of the internal organs. So if you were to look on the right side of the pharmacological effect, right, it says Da Huang has a gastroprotective effect, pancreas protective, hepatoprotective, nephroprotective, radioprotective, and so on. Well, guess what? Another way to say it is this herb has an effect to treat gastritis, to treat pancreatitis, to treat hepatitis, to treat cholecystitis, to treat nephritis, right? So these are all internal organs, whether stomach or liver or pancreas or gallbladder or kidney with itis, right? So basically Da Huang treats the inflammation of these organs to reduce the inflammation. Okay, so once again, Da Huang is not just a laxative or purgative herb, it's a very effective herb to treat inflammation of the internal organs. Okay, but try not to use it for inflammation of the exterior. Okay, because a lot of time when people think of anti-inflammatories, they think of NSAIDs, non-steroidal anti-inflammatory drugs, and those are primarily used for treating musculoskeletal system. Da Huang is an anti-inflammatory, but mostly for the internal organs. All right. General indications include constipation, intestinal obstruction, so those are the primary ones. And then, like I mentioned earlier, it has a protective effect to treat inflammation in many different parts of the internal organs, right? So you can use it to treat peptic ulcer, gastritis, enteritis, gastroenteritis, hepatitis, cholecystitis, pancreatitis, and so on and so forth. Okay, so two main effects once again are laxative purgative effect and also anti-inflammatory effect for the internal organs. Okay, Da Huang also has an interesting paradox, and that is it sometimes treats and causes the same condition at the same time. And what I mean by that is if you can use it to treat constipation, right? So what happened is it's the anthraquinones, which is part of the active compounds that actually induce peristalsis and treat constipation. These are easily water soluble and they are extracted out of the herb best if you cook it for only about 5 or 10 minutes. Okay, but what happened is when you cook the herb in decoction for too long, then what happened is the anthraquinones are then deactivated and the tannins are then extracted out of the herb, and tannins then cause astringent effect and cause constipation. All right, so to get the best out of Da Huang to treat constipation, make sure you cook it in decoction only for 5 to 10 minutes. Otherwise, if you cook it for too long, let's say half an hour or longer, you actually end up with side effect of inducing constipation. Okay, Da Huang also has a paradox effect on the stomach. On one hand, it helps to promote the generation of prostaglandin, and that helps to heal the gastric mucosa. But at the same time, it has a bitter and cold property that can irritate the gastrointestinal tract. So mild irritation is equals to increase in peristalsis, but severe irritation may equal to nausea, vomiting, and other GI symptoms. Okay, and lastly, same for the liver. Okay, at low doses, it helps to protect the liver, but at high doses, it may actually increase and cause damage to the liver by increasing the risk of liver fibrosis. Okay, so once again, Da Huang is a very strong and potent herb. Okay, generally speaking, you should use it at an appropriate dose, only for as long as necessary to treat the condition. And once the condition is alleviated, you don't really need to use it any longer than that. All right, so that is Da Huang rhubarb. Okay, the second herb that's generally paired together with Da Huang is Mang Xiao. Mang Xiao is generally translated as nitrogen sulfas or myrobalanum. Okay, and basically this is a mineral substance. Okay, and the clinical TCM function is to purge the excess, to soften the hardness, and clear heat and sedate fire. All right, so it's primarily used as a laxative. Okay, and how Mang Xiao works is as a mineral, it has a osmotic effect, or in this case also described as a hyperosmotic effect. So what it does is it draws water from the body into the intestines, therefore increasing the water content, increasing the amount of pressure that's pressed against the intestinal wall, and therefore induce the bowel movement. Okay, so Mang Xiao is a mineral that works by osmotic pressure to induce bowel movement. All right, so for Mang Xiao to work, basically you take it in decoction or take it in powder form. It goes to the stomach, it goes to the intestines, and you will start to work, in fact, relatively quickly. Generally speaking, the patient may start to feel the increased pressure and the urge for bowel movement somewhere between 1 to 2 up to 3 or 4 hours. Okay, so within a relative short period of time, they will start to have urge or bowel movement. Okay, and Mang Xiao is most effective for treating constipation, in which there is dryness, there is lack of fluid in the intestine. Okay, and this is, I would say, most common in drug-induced constipation. And the drug that's most likely to do this is the opioids. Okay, opioid is the drug that includes Tylenol with codeine, Vicodin, Lorcet, Lortab, morphine, and so on and so forth. Okay, and what happened with these drugs is that they have a severe effect to dry up the body fluids. And in fact, if you think about it, right, one of the Chinese herbs called Ying Su Ke, which is the opium poppy, in fact the plant origin where these opioid drugs come from. And Ying Su Ke is an astringent herb, and it astringes and take away the body fluids, especially in the intestines. And in fact, one of the functions of Ying Su Ke is to treat diarrhea. All right. So what happened with the drug is the side effect that it has is to dry up the intestines to treat constipation, or dry up the intestines and cause constipation. All right. So Mang Xiao in this case would be the best herb to treat the opioid-induced constipation. Okay. So those two are the examples of stimulant laxatives. The next herb, Huo Ma Ren, Fructus Cannabis, is a moist laxative. And moist laxatives are generally going to be the seed type of herbs or fruits type of herbs because they have the lipids to help to moisten the intestines, lubricate the bowel, and in turn relieve constipation. All right, so Huo Ma Ren is the first example. The main thing here is the Huo Ma Ren must be dry fried, so the seeds are no longer viable, so they cannot be planted and grown. And that's for political or not legal reasons. More it is for more than it is for medical reasons. Okay, so Huo Ma Ren once again is a moist laxative. Okay, another moist laxative is Yu Li Ren 7 Prudence. Okay, and once again same thing. It moistens the intestines and relieve constipation, and it belongs in the moist laxative category. All right. So now as we put the herb together into formulas, okay, the first type of formulas are going to be the strong stimulant laxative type of formulas, generally for treating the acute, urgent interior excess conditions, mainly for severe constipation, but you can also use them for intestinal obstruction, severe cases of food stagnation, and so on. All right. And the first example is Da Cheng Qi Tang, major order of the qi decoction. And the ingredients are Da Huang, Mang Xiao, Hou Pu, and Zi Si. So obviously Da Huang and Mang Xiao, rhubarb, and nitrous sulfas are the strong stimulant laxatives to purge whatever that's accumulated in the body, in the interior. And then Hou Pu, magnolia bark, and Zi Si, aurantium are the qi moving herb to help to move the qi and the energy at the same time. Okay, and together they are used to treat excess Yang Ming Fu syndrome with all the signs and symptoms listed here. Okay, and also empathic stools with watery fluids. Or from a Western perspective, these are all the indications. All right, so there's quite a bit. You can read this on your own. I'm not going to read it back to you. All right, so overall, this is a very strong, very potent formula that should really be used only for urgent situations. Okay, and for formula like this, if you can use the decoction, generally speaking, the decoction or the liquid form will be more potent and have a faster onset of action compared to tablets and also capsules. And the reason, of course, is the solid dosage form needs to be dissolved, needs to be disintegrated before they can be absorbed and carry their effect. All right, so if it's a truly urgent condition, then the liquid dosage form will be more appropriate and will be stronger and work faster. Okay, another example of a strong stimulant laxative formula is Xiao Cheng Qi Tang, minor order the qi decoction, and the three ingredients are Da Huang, Hou Pu, and Zi Si. Okay, so once again, it's very similar. The only ingredient that's missing is Mang Xiao, merebolidum, or nitrium sulfas. Okay, and this is for a very similar, condition. Once again, in TCM, this is for excess Yang Ming Fu or hollow organ excess syndrome, and in Western medicine, all kinds of constipation and inflammation and infection of the internal organ type of conditions. All right. And then we also have formulas that are considered moist laxative formulas. And once again, this is good for constipation in which the patient has underlying weakness and deficiency. Maybe somebody that's older, somebody has a lot of blood deficiency, somebody who has just overcome a chronic health condition, or maybe somebody who, like a pregnant woman who have recently given birth and they are quite weak, but they are also constipated. These are the patients that cannot take a strong laxative or purgative, so you need to use ones that are gentle, that are not too harsh. Right? So Ma Zi Ren Wan hemp seed pill will be one example like that. Okay, and you can also notice that in this case, there's no need to use the Tang decoction type of formulations, because Tang decoction is more for urgent conditions. This is for somebody with habitual constipation or mild constipation. So the pills will be just fine. Okay, and in addition, historically the pills are usually made with honey. Okay, so you grind the herb into powder and you mix it with honey to make it into pill. And honey will not only bind all the powder together, but honey inherently also has a moistening effect to treat constipation. All right, so in this case, the solid dosage form, such as pill, is more appropriate than the decoction. All right, so these are the ingredients. As you can see, a lot of seeds, Huo Ma Ren, Ku Xing Ren. Okay, is for treating dryness and heat in the stomach and intestines, along with underlying deficiency. Okay, and the Western indication is habitual constipation, or constipation in elderly individuals or postpartum women. So somebody who has mild to moderate cases of constipation who also have underlying deficiency. All right, and then lastly, another very similar formula is Wen Chang Wan moisten the intestine pills. So once again, it's a pure dosage form that is more appropriate for the mild to moderate constipation. Okay, and once again, you also have a lot of seeds, Tao Ren, Semen Persica, and also Huo Ma Ren, cannabis seed, along with Dang Gui, Angelica sinensis, to help to tonify the blood in case if the patient has underlying blood deficiency. Okay, so indication in this case, once again, is very similar. Is for mild to moderate constipation in somebody who is older, weaker, or have underlying blood deficiency. All right. As far as collection formulas go, Gentolac XS is for the interior excess condition. So basically, the more serious constipation, the more serious interior excess conditions. Okay, so once again, severe constipation, inflammation of the internal organs, and somebody who is otherwise healthy and robust. Okay, Gentolac deficient is for somebody who has mild to moderate constipation but has a little bit of underlying deficiency. Okay, so once again, this is more appropriate for somebody who is weak, who is deficient, who doesn't have very strong severe constipation. Okay, and you might also notice that at the bottom it says this formula contains soy, and the reason is because the very last herb here is 制何首乌, which is the process or prepare polygonal multiflorum. And what happened is this herb during the preparation process is prepared with black soybean to remove the strong purgative effect or strong downward draining effect. All right, so soy was used to prepare 制何首乌, and inherently there's going to be some soy left in the herb. So those who have soy allergy should use this herb with caution, use this formula with caution, or not at all. All right, and then lastly, this formula called GI Detox is a formula for treating patients who have chronic constipation, who have food stagnation for a long period of time. And what happened is in your intestines, our intestine is not a straight tube, but rather there's a lot of villi, okay, a lot of folds in the intestines. And what happened is when these patients have food stagnation, food accumulation, and constipation for a long time, what happened is there's a lot of things that are stuck in between those folds, in between those villi. And then what happened is the patient start to absorb a lot of things that they are not supposed to. Okay, so this is a formula that is more than just a purgative formula or moist laxative formula. It helps to flush out all the stools. It helps to move and massage the interior intestines, and basically try to get rid of all these things in the intestines as much as possible. Okay, so this is a GI detox formula, namely for patients who have chronic indigestion, food stagnation, all those problems that I just mentioned earlier. All right, so this concludes our first part discussion on the downward draining herb. And once again, I think this is very important because a lot of people today do have constipation, have interior excess problem. And once again, it's important to treat the constipation, but remember that constipation at this point, when the patient comes in, is merely a symptom. Okay, once you are able to use herb to treat the constipation, you need to dig a little bit deeper and find out why they are having this in the first place, and then treat that accordingly. Okay, it could be somebody who has a very poor diet. A lot of the food that we have today are rich in calories but very poor in nutrients, and this is especially true for the canned food and the processed foods. Okay, so if that's the case, then obviously they need to eat much better diet, okay, to treat this problem from the root. Okay, a lot of people may have constipation from the stress. Okay, and if that's the case, then you need to use herbs to treat the liver qi stagnation. A lot of patients may have a chronic issue in which they have a weak digestive system, where the intestines are no longer moving. There's lack of intestinal peristalsis. And if that's the case, you need to use herbs to strengthen the spleen and stomach, and also to move the qi. Okay, and those are the herbs that will help to move and increase the intestinal peristalsis. And then lastly, of course, there are a lot of people with drug-induced constipation, mostly from opioids and also from antipsychotics. Okay, so then the patient needs to evaluate to see whether those drugs are still necessary or not. Maybe have a discussion with the MD to see if the drug can be tapered down in dose or discontinued. Or if not, then the next best thing you can do is to use herb to treat the drug-induced constipation. So if they have to be on the drug, then at least they can use herb to help to prevent and alleviate constipation. All right, so don't think of just treating the constipation. Think beyond that and help the patient to treat the cause as well. Okay.
Does Huang treat the effects of radiation?
Does Huang affect radiation?
Treat the effects of radiation.
Huang does not directly treat the effect of radiation. Okay, but what happens is radiation generally will do two things. Radiation will cause inflammation and will also cause underlying deficiency. Deficiency primarily refer to qi deficiency and indeficiency. All right, so what happens is the he part, the inflammation part, is what Huang helps to treat, but you have to look at the underlying deficiency as well and prescribe herb that tonify the qi and also nourish the yin to treat the underlying deficiency. So you have to do both at the same time.
Is Huang safe for obese people?
Is Huang safe for obese people? Once again, if you use mild, low to moderate dose in someone who is otherwise healthy and robust, and use it for the right duration, it's fine as long as it's called for. But generally speaking, obese people tend to have a little bit of underlying deficiency. Obesity by itself refers to some accumulation of damp and phlegm, as well as some deficiency of the spleen and stomach. All right, so if you do use Huang, make sure you watch out for the spleen and stomach deficiency.
Might the Changhua in moisten the intestines pill be used as a guiding herb to the Taiyang UB meridians to guide out through the rectum?
Yes, that will be fine.
Okay.
Okay. Let's move on now to the digestive herbs. Okay, and once again, digestive herbs are also very important because they help us get the most out of whatever food that we eat. Okay, historically, eating disorder generally is not a problem in China in the past, and part of the reason is because historically China has always been a country characterized by having too many people and not enough food to feed all the people. All right, so what happened is people just eat what they can, whatever they can, whenever they can. But what happened is historically when there is a certain festival, okay, so whether it's Chinese New Year or certain Buddhist holidays or moon festival and so on, then what happened is a lot of foods are then provided, and then patients or people generally tend to overeat during those times. And as a result, their body is generally not accustomed to handling eating a lot of food. Then they end up with food stagnation. All right, so most of the food stagnation or indigestion type of problem generally occur as a result of overindulgence of food. Okay, so during those times, then the digestive herbs are prescribed to help the patients digest the food, benefit from the nutrients, and at the same time treat indigestion and food stagnation. Okay, in our environment today, what usually happens is you still have patients that overindulge. Okay, perhaps not as much. Maybe during the holidays. So in case for us, it might be the Christmas, it might be the New Year holiday, or it might be whenever certain people go to buffets and end up eating too much. Okay, but beyond that, what also happened once again is the food today tend to be overly processed. Okay, so a lot of food once again have a lot of calories, they have a lot of sugar, but not a lot of nutrients. So digestive herb from that perspective will also help to digest the food and whatever they can do. Okay, and at the same time, another main benefit of digestive herb is for patients whose digestive system have been damaged. And in this case, it's mostly the antibiotic cause type of damage. Antibiotics are by and large bitter and cold. Okay, so those herbs, those type of substance tend to be harsher on the digestive tract. Beyond that, what also happens with antibiotic is that a lot of the more potent antibiotic drugs have a very broad spectrum of antibiotic effect. And the trouble with the benefit with that is they will help to treat a lot of different infections. And the trouble with that is they will also kill the healthy bacteria. So if the patient take those broad spectrum antibiotics, there is a risk of the drugs wiping out the normal flora, and therefore they end up with secondary infections. All right. So what that generally shows from a TCM perspective is they have deficiency in cold of the digestive system along with DAMP. And the deficiency in cold refers to the lack of normal flora, and the DAMP will refer to the secondary infection that occur as the normal flora is wiped out and the bacteria, harmful bacteria, grow back faster than the healthy bacteria. All right, so these are all some of the common scenarios in which digestive herbs are very helpful. All right, so now let's look at the definition and the disease as well as the specific examples. So digestive herbs are herbs that promote digestive function to strengthen the spleen, enhance appetite, promote digestion, and relieve food stagnation. All right, they are generally used for treating indigestion, food stagnation. Okay, along with all the signs and symptoms of fullness, distension, pain, discomfort, belching, acid regurgitation, nausea, vomiting, and so on. All right, so once again, these are all the signs and symptoms that refer primarily to indigestion and food stagnation. Okay, and then from a biomedical or Western medicine perspective, digestive herbs are used to treat indigestion, gastroparesis, intestinal paresis, dysmotility, gastroenteritis, and also peptic ulcer disease. Okay, but I would say the earlier ones tend to be more applicable. Okay, and not so much gastroenteritis and peptic ulcer disease because they tend to be more excess. You probably need other herbs in addition to just digestive herbs. All right, digestive herbs primarily have effect on the digestion and also effect on the digestive system. And what I mean by that is a lot of the digestive herbs contain a lot of digestive enzymes. Okay, so these are the enzymes that inherently will help to digest the fat, digest the protein, digest the carbohydrate, digest the alcohol. Okay, so the digestive herb contain the enzymes that will directly help with digestion of the food. They also have effect on the digestive system. And what I mean by that is these are the herbs that will also help to strengthen the spleen and stomach, that will help to increase the production of the stomach acid, that will help the body to help itself to digest the food, to push the food down, and also to absorb the food. All right. So in other words, digestive herbs have a direct effect for digestion, and also have an indirect effect to help the body to digest food. All right. So indirect and also direct effect. And then on top of that, a lot of the digestive herbs also help to lower the lipids in the body, in the blood primarily. So they help to lower the triglycerides and the total cholesterol levels. They also help to reduce the atherosclerosis in the blood vessels. All right. And the pharmacological effect is anti-hyperlipidemic and also anti-atherosclerotic. All right. So basically think of the triglyceride, the cholesterol, and atherosclerosis basically start out as dampness, then phlegm, then blood stagnation. All right, so in the beginning, it's dampness, right? So when they start to have too much calories in the food, they have too much sugar, right? As those type of things are absorbed, it creates dampness. So initially, it's obesity. Then as the dampness turns into the phlegm, then what happens is the cholesterol levels start to rise, right? So in the beginning, it's elevated blood glucose. Now it's elevated triglycerides and also elevated cholesterol. And then finally, as these cholesterol gets deposited inside the blood vessels, they cause damage to the inside of the blood vessels. Now the dampened phlegm turn into blood stasis. Or in other words, the cholesterol damage the inside of the blood vessels and cause clotting and cause embolism. Once again, that's embolism and clotting disorder is the blood stasis in Chinese medicine. All right, so to some extent, the digestive herbs also have effect to help to lower the blood sugar, lower the triglyceride, and also reduce the risk of atherosclerosis. All right, some of these examples, number one is sanza, which is commonly known as hawthorn berries or Crataegi. Okay, so it has a direct effect to promote digestion and eliminate stagnation. All right, so sanza from a pharmacological perspective or chemical composition perspective contain a lot of digestive enzymes to help to directly digest the food. Because it's sour, it also has effect to stimulate the stomach to produce more gastric acid to help to digest food. Okay, and lastly, it has stimulant effect to help to stimulate the intestines to increase the peristalsis. All right, so sanza is a very, very good herb as a digestive herb to directly and indirectly help to treat indigestion and food stagnation. All right, sanza also has effect to activate blood circulation and disperse blood stasis. That is actually more of a Western herbalist type of indication. And the reason is because to get the most out of that function, it's best to use alcohol as a solvent to extract out those active ingredients. And when you do that, then it becomes more of an herb for cardiotonic function, to improve the blood circulation, to lower the cholesterol, and so on. You will still get that effect as a water-based extraction, but it will work better, if you have an alcohol base. So you can either dry fry the herb with alcohol first, or you can use alcohol-based type of extract. Okay, so that's sanza. Sanza also has a cardiotonic effect, like we mentioned earlier. So that is kind of similar to a drug called digoxin or lanoxin. All right. So what happens is if the patient is on lanoxin, you need to be careful with sanza because they have similar effect or additive effect. You don't want to overdose on the patient. Okay. The next herb is an herb called Shen Qi. Shen Qi is translated as Massa Fermentata or Massa Medicata Fermentata. And the reason is because Massa means probably a big mass, Medicata is medicine, and Fermentata is to ferment. So this is basically a block of many herbs that are combined together. Okay, so it's not a one single herb. You can actually consider this as a herbal formula if you want. So anyways, the 6 ingredients that I use here are 苦杏仁、四小豆、青蒿、苍耳草、利劳, and also wheat flour. So basically the 6 herbs are blended together and fermented together and then cut into square or rectangular blocks, and that is what we call single herb, but it's actually a single herb with 6 ingredients. And the function of this particular substance is to promote digestion and harmonize the stomach. And this herb is most effective because it actually has a lot of digestive enzymes. All right, so historically, this is most effective to help with digestion of many different type of food, especially if the patient happens to eat too much all at the same time. All right, so that's the best use of this herb. This herb also has another main use, and that is historically, it's commonly used along with a lot of heavy mineral type of herb, whether it's heavy metals or magnet type of substance or shell type of substance, things that are very heavy, that are very hard to digest, that are harsh on the stomach. So what happens is Shen Qi will not only help with digestion, it will also help to protect the digestive linings, the stomach linings, the mucous linings. So those harsh substances are less likely to damage the spleen and stomach or the actual stomach itself. All right. So today, one of the main use of this herb is if the patient happens to take any drugs that are very harsh on the digestive lining, stomach mucus lining itself, then Shen Qi can be taken before the drug, once again to help to coat the stomach as a physical barrier to protect the stomach. All right, and the best example of those drugs are the NSAIDs, the non-steroidal anti-inflammatory drugs, whether it's aspirin, ibuprofen, naproxen, Voltaren, Celebrex, and so on. So if you take Shen Qi before those drugs, it will help to minimize the drug-induced stomach and intestinal damages. All right, this herb, if you look over here, contains nuts, which is 苦杏仁, and also contains wheat flour. So a patient that has tree nut allergy or wheat allergy should use this herb with caution or not at all. And that applies to glucose intolerance too, because it has wheat. Okay. Another interesting herb is Hong Qu. Hong Qu is basically the red rice yeast. So historically, this is an herb that's generally listed right next to Shen Qu. So what happened is this is also a rice. It's fermented with red rice yeast to help with digestion, to help to treat indigestion, promote digestion, and at the same time, it invigorates blood circulation and eliminate blood stasis. Okay, and remember that last part, because what happened is Hong Qu, during the fermentation process, has a byproduct called lovastatin, and lovastatin is the main ingredient in the drug Mevacor, which is generally used for treating hyperlipidemia. Okay, so what happened is, once again, remember, hyperlipidemia or high cholesterol increases the risk of heart attack. All right, so this herb or this drug is used to lower cholesterol and in turn help to prevent heart attack. Once again, from Chinese medicine, okay, if you have patients that have dampness that turn into phlegm, that turn into blood stasis, okay, you need to treat that by drying up the phlegm, drying up the dampness, eliminate phlegm, and promote blood circulation and eliminate blood stasis. So in a way, Hong Qu is an herb that helps with indigestion, but also at the same time help to invigorate blood circulation and eliminate blood stasis, because it also has the effect to dry up the dampness and eliminate the phlegm. Okay, and obviously the Western pharmacological term is anti-hyperlipidemic. Okay, and what's interesting is Hong Qu obviously contains much less lovastatin than the drug counterparts, but it has been found that Hong Qu is actually more effective than the drug counterparts. Okay, so what that most likely implies is that Hong Qu has many other active ingredients not just lovastatin, and they all work together to help to lower the cholesterol levels. Okay, but if you do use this particular dietary supplement, then keep in mind that it does have lovastatin, and there are a lot of drug-herb interactions or drug-drug interactions between lovastatin and all the other drugs, and this is a list of those other drugs. The other thing to keep in mind is these are obviously interaction is dose dependent. Okay, so the larger the dose, the more significant the interactions. The drug counterpart, Mevacor, obviously contain much larger amount of lovastatin, and the herb a lot less. So for the herb, these are interaction you need to be aware of, but most likely if you do use it in supplement, the potency or the severity of interaction is going to be significantly less compared to the drug counterpart. All right. Another digestive herb is one called Ji Nei Jin, endothelium corneum. I can't pronounce it, but basically what it is the inner lining of the chicken gizzard. Okay, and this is an herb that helps to promote digestion, stimulate the spleen, strengthen the spleen, consolidate Jing, the essence, and prevent leakage. It also softens the hardness and dissolves stones. All right, so the first part is basically what we are discussing here, which is to promote the digestion and strengthen the spleen and stomach. So basically another herb that contains a lot of digestive enzymes to help to treat indigestion and promote digestion. All right. One other thing that's very, very beneficial for this herb, and we can see it from the bottom here, is that it helps to soften hardness and dissolves the stones. So this is actually one of the most important herbs, most effective herb to help to treat stones in the body. And stones can refer to gallstones, kidney stones, bladder stones, and even stomach stones. So basically different type of hardness that are formed in the body. And historically, these are the three herbs that are generally paired, or not paired, but combined together for the best synergistic effect. And these are called San Jin, or the three go. So you have Ji Nei Jin, which is the chicken gizzard, Hai Jin Sa, Spora Lycodium, and Jin Qian Cao, Herba Lysimachia. All right, so these are the three herbs that are generally combined together to treat stone. And then what happens after that is, depending on what type of stone you are treating, you then add other herbs as needed, right? So if you're treating somebody with gallstones or stone in the bile duct in the liver area, then that is, generally speaking, some type of DMP in the liver and gallbladder, right? So in addition to these herbs, you want to add some herb that clear DMP from the liver and gallbladder. You want to add some herb that guide the formula to the liver and gallbladder. Okay, that will make your formula more effective. And if you're treating somebody with a kidney stone or bladder stone, that is DMP in the lower jaw. Okay, so you want to add some herbs that will treat DMP in the lower jaw. I want to add some herbs that will help to guide the effect to the lower jaw, and then add some herbs that have diuretic effect to help to increase the volume of urine to help to flush out the stones. All right, but nonetheless, these are the three key ingredients that you must have. All right, as far as digestive formula goes, there is basically only one that you need to know, and the reason is because when somebody overindulges on the food, chances are they have eaten a little bit of everything, a little bit too much carb, a little bit too much protein, a little bit too much fat, alcohol, and so on, and they end up with food stagnation and indigestion. All right, so this classic formula called Bao He Wan Preserve Harmony Pill is designed to treat basically indigestion and food stagnation with a little bit of everything. All right, so whether it's fried food, fried chicken, whether it's pizza, cheese, pretty much anything. This formula will, generally speaking, work very, very well. And obviously, if you can take it ahead of time, that would be the best, because if you overindulge and eat too much, then what happens is, generally speaking, it's already very painful. It's hard to swallow and take any more things. But in any case, if you need to do it, this is, like I said, still the best formula to use, pretty much for any type of food overindulgence. All right, this is the indication, along with all the signs and symptoms, along with the Western disease names. All right. This is a collection formula for treating gallstones, dissolved GS. So once again, has the Jin, the gold type of herbs, to help to treat the stone, along with herbs that drain damp heat from the liver and gallbladder. But I'll point out that it doesn't have Jin in the formula. And the reason is because all these formulas, by the way, are pre-cooked together and extracted together in Taiwan and then imported to the United States. And what happened is during the time when there was a lot of bird flu scares from Asia, what happened is the customs and border patrols in US and pretty much every country is very, very strict as far as not letting any avian or bird products into the United States. So what happened is anything that comes from the birds, including the chicken, basically cannot come in. And what happened is if the herb has jin as one of the ingredients, we could not import it. All right, so we have no choice but to take out that ingredient, and that's why it's not here. But if you do use this formula, we found the formula to still work very well. If you want to add that ingredient in, then what happened is either have the patient buy the chicken gizzard from supermarket and add it in, or buy the single herb if they can and add it in. But in any case, jin is an ingredient that would ideally be in here, but you can certainly add it afterwards. All right, so this is a great formula for treating gallstones and inflammation of the bile duct. And then the other formula is dissolved KS, and this is for the kidney stones, bladder stone. And once again, the formulation rationale is like I mentioned, use those jin herbs plus guiding herbs plus herb to treat damp heat in the affected area, along with diuretic herbs. All right. So once again, these are two stones that respond very, very well to Chinese herbs, but in Western medicine, there is very little options. Okay, so if you come across patients with these stone conditions, by all means, treat the patient with herbs, treat them aggressively, use larger dose of herbs. If you can treat them and resolve the condition with Chinese herb, then that's great. Okay, if not, then Western medicine or surgery can always be available as the last option, as the last resort. All right, so that's my presentation today on the downward draining herbs and also on the digestive herbs. If you have any questions at all, feel free to send me an email directly or send an email to Donna, and then I'll be more than happy to answer whatever questions you have. The material is available. You can get the handout. If you want to get more information, most of what I cite are from the books, Chinese Medical Herbology and Pharmacology, Chinese Herbal Formulas and Applications. So the first one is for single herbs. This one is for formulas. And this last one, Clinical Manual of Oriental Medicine, is for the collection formulas. All right. So once again, thank you very much. And I look forward to seeing you next month. Sure. I'll answer a couple questions before we leave.
Which herb or formula is the best for people with low stomach acid?
Low stomach acid. Generally, that happens only after a long-term disorder. Meaning, and the example I'm thinking of is, this is something that generally starts out with acid reflux or peptic ulcer disease. All right. So what happened in the beginning? This is the condition most people have, either from too much stress, eating too much spicy food, and they produce too much stomach acid. But so in the beginning, this is a stomach heat condition. But over time, what happens is the heat causes the underlying indeficiency. Or in other words, the stomach heat starts to erode on the stomach lining and therefore cause damage to the stomach cells. So over time, the stomach heat condition turns into stomach indeficiency. Okay, or stomach ulcer turns into atrophic gastritis. So at that point, what happened is the patient now end up with lack of stomach acid. So what you need to do at this point is use herbs that nourish in, and also use herbs that are probably a little bit on the sour side to help to repair the underlying damage, and also to stimulate the production of the stomach acid. So you can use Wu-mei, Fructus Mu-mei. You can use Bai Sao, white peony. You can use Mu Gua papaya. So basically ones that are more nourishing, that are more sour in nature, to help to stimulate the production of the stomach acid.
Can someone with gluten sensitivity take Shen Qi?
With low what?
With gluten sensitivity.
Gluten sensitivity, no, because Shen Qi has wheat. Okay, so if they have a serious gluten sensitivity, then they should not take it. If it's not too bad, then they can try it, because it's a small part of the herb, and if they take the entire formula, you're looking at a relatively small amount.
If Shansa is in a formula, is it problematic to use with digoxin?
If Sanza is in a formula, once again, it depends. Okay, Sanza does have a cardiotonic effect, but much more so if you use it as a alcohol-based tincture, and if you use it sublingually. Okay, if you use it as a water-based, then it becomes, I would say, more of a theoretical interactions, not as much as a clinical interaction. Okay, because once again, formula usually has many ingredients, so Sanza is one of the many. And then if it's a water-based extract, then the cardiotonic effect is relatively little compared to the tincture base. Okay, but nonetheless, it's still something you should keep in mind. So perhaps you can start out with a lower dose, see how the patient responds, and then go from there.
What do you recommend for borborygmus?
For borborygmus, once again, use herbs that strengthen the spleen and stomach and also move the stomach qi. Okay, so maybe Xiang Sa 六君子汤 would be a good formula to strengthen the stomach, with 六君子汤, the 6 gentlemen, and then Xiang Sa are the 2 herbs added to dry the dampness and move qi. All right, thank you very much.
All right, guys, that concludes today's webinar. Thank you so much for joining us. Today's class has been recorded, so it will be on our TCM Wisdom Tube tomorrow afternoon. We will also upload it onto our YouTube channel, so you can watch it on YouTube as well. That is it for today, everyone. Thank you so much, and we will see you at our next webinar. Bye.